Welcome and thank you for being here. Today I want to introduce you to the innovative, science-backed healing approach we use at Makari Wellness, a blend of orthopedic acupuncture, dry needling, gua sha, active release techniques, art, manual therapy, and stability training. This powerful combination consistently delivers faster, more lasting recovery from pain and dysfunction. Whether from acute injuries or chronic strain, millions suffer from musculoskeletal pain. Common issues include tendinitis, tendinosis, bulging discs, sciatica, and repetitive strain injuries. These conditions stem from inflammation, poor circulation, scar tissue, and most critically, impaired neuromuscular coordination. Most muscular imbalances begin either with trauma or from poor posture and movement. These lead to compensatory patterns. Some muscles overwork, others underperform, and scar tissue builds. This is what we call the software problem. The brain no longer communicates properly with the body. At Makari Wellness, we break this cycle. First, we assess dysfunction using orthopedic testing and movement analysis. Then we apply targeted interventions, orthopedic acupuncture and dry needling to release deep trigger points and increase blood flow. Art and manual therapy to mobilize tissues, reduce fibrosis, and decompress nerves. Gua sha to stimulate lymphatic drainage and microcirculation. Modern science confirms acupuncture's effects. It stimulates A delta and C fibers, promoting endorphin release. It increases local nitric oxide, boosting microcirculation. It modulates pro-inflammatory cytokines, reducing chronic inflammation. These effects enhance recovery in tissues like tendons, fascia, and discs. Art and manual techniques free adhered tissues and restore glide. Research shows manual therapy improves fibroblast activity and accelerates the breakdown of scar tissue, especially when combined with movement. Once we've released tissues and improved circulation, we shift to reprogramming the neuromuscular system. Using movement drills, breathwork, and core engagement, we ensure muscles fire in the right sequence. Think of this as rewriting the software, making sure each muscle does its job, no more, no less. Most patients feel significant relief in 4 to 6 visits. Full functional recovery occurs in 6 to 10 treatments, far faster than conventional physical therapy or passive care. Our patients return to sport, life, and work with fewer relapses because we address both the hardware, which is the tissues, and the software, the neuromotor control. We begin with orthopedic assessments and functional movement screening, not just to locate pain, but to identify why that pain exists. A straight leg raise test might point to a nerve root irritation, but an overhead squat may reveal the instability that led to that disc bulge in the first place. These tools let us map out the kinetic chain to identify movement faults, muscular inhibition, or compensatory motor patterns, all of which must be corrected to ensure long-term recovery. Electroacupuncture is not just acupuncture with wires, it's neuromodulation with purpose. By stimulating A delta and C fiber nerve endings, we activate the body's descending inhibitory pathways. This floods the central nervous system with endogenous opioids like enkephalins and beta endorphins. Research shows electroacupuncture also increases local nitric oxide production, which causes vasodilation, improves capillary perfusion, and enhances oxygen and nutrient delivery to damaged tissues. It's especially effective in chronic conditions like tendinosis, where ischemia and low-grade inflammation cause poor healing. Now let's talk about scar tissue, fibrosis, and adhesions, the hidden culprits behind many chronic injuries. When we apply active release techniques, we manually tension the tissue while moving it through range. This mechanically stimulates fibroblasts, the cells that produce and align collagen. From a physiological standpoint, this is known as mechanotransduction. Mechanical input becomes biochemical instruction, leading to better tissue remodeling. This is critical in conditions like frozen shoulder, Achilles tendinosis, or post-surgical adhesions where collagen is laid down disorganized and stiff. Gua sha may look ancient, but it's deeply relevant in modern physiology. Scraping the skin stimulates the surface immune response and increases blood flow up to 400% in the area, based on thermographic and microvascular studies. It upregulates HO1, heme oxygenase 1, an enzyme involved in cytoprotection and inflammation modulation, and decreases pro-inflammatory cytokines like IL-6 and TNF-alpha. This makes it ideal for myofascial pain syndromes, old injuries, or overtrained tissues. In addition to anatomy-based needling, we also use channel theory from classical Chinese medicine, particularly the master tongue system. These distal point strategies can produce systemic effects. For instance, using Linggu and Dabai for sciatic pain stimulates contralateral brain activity, shown in fMRI studies, helping reset aberrant pain pathways. Combining local and distal points gives us both tissue-specific and neurological level interventions. Finally, we integrate stability and neuromotor re-education. Think of this as rewriting the software after fixing the hardware. Injuries cause muscles to shut down or fire out of order. Over time, this leads to compensations, hip flexors doing the job of the glutes or the upper traps overworking because the serratus anterior isn't showing up. We retrain feed-forward motor control, particularly around the spine and pelvis, to ensure the right muscle fires at the right time with the right load. This is the key to preventing re-injury and restoring authentic movement. So why does this work better than what most patients have tried before? Because we're not chasing symptoms. We're correcting systems, tissue, nerve and movement all at once. Let's take a common example, lateral epicondylitis or tennis elbow. It begins as an overuse injury, microtears in the extensor carpi radialis brevis tendon. As healing fails, fibrosis forms, blood supply drops and nerve irritation begins. What we do is threefold. 1. Break up adhesions and increase perfusion with art and electroacupuncture. 2. Modulate local inflammation and immune activity with gua sha. 3. Restore extensor flexor synergy and scapular mechanics with corrective movement. This trifecta rewinds the entire injury process. Tendinitis versus tendinosis. Tendinitis is acute, inflammatory. Tendinosis is chronic and degenerative, often lacking inflammation. Treatment must restore collagen integrity and circulation. RT and EA do just that. Bulging discs, nucleus pulposus pressure on annular fibers and nearby nerves creates not only radicular pain but also reflexive muscle guarding. We address both with manual decompression EA and lumbar pelvic stabilization. Sciatica can be discogenic or muscular, like piriformis. We identify the origin and treat both the structural compression and the associated compensatory movement patterns. Scar tissue, not just surface level. Post-surgical or post-injury scarring creates fascial drag, alters proprioception and can tether nerves. Art and gua sha restore gliding and signal clarity. Makari Wellness is leading a new paradigm in musculoskeletal care, where manual therapy meets neuroscience and where every treatment is backed by physiology, not guesswork. Most patients see results in 4 to 6 sessions with complete recovery in 6 to 10. Why? Because we treat the cause, not the symptom. We don't just patch the pain. We retrain the brain, restore the tissue, and rebuild the system. That's the future of manual medicine, and it's happening now. If you're struggling with pain, injury, or limited mobility, it's time to work with a specialist who understands the body from the inside out. Michael Woodworth brings over 20 years of hands-on experience and advanced training in spinal mechanics, functional movement systems, orthopedic acupuncture, electroacupuncture, dry needling, active release techniques, gua sha, and therapeutic massage. At Makari Wellness, with locations in San Diego and Oceanside, California, Michael has helped thousands of patients recover faster, move better, and stay pain-free longer. Don't just take our word for it. With well over 100 five-star reviews, patients frequently share stories that may sound just like yours. Visit MakariWellness.com to learn more, or check out our Yelp and Google reviews for each location to see how others have regained their health and movement. Start your recovery today with expert care that lasts.